Hello, this is Luis. Welcome to the HDTV updates from the IDF World Diabetes Congress 2022. Today, we bring you the Day 1 updates of IDF 2022. Today, Prato spoke at a session on the clinical implications of Tirzepatide efficacy and safety data, where he questioned whether Tirzepatide represents a first opportunity for diabetes remission. It has the potential to be used as a novel form of combination therapy. Tirzepatide also provides superior cardiovascular benefit as well as superior and sustained glucose and body weight lowering. Mussa presented the interim analysis report of a trial that evaluated the real-world clinical effectiveness and patient insight associated with the addition of SGLT2 inhibitor to Gliclazide MR. The individuals who received this combination had a high CV risk and were overweight. There were no CV safety concerns reported, and the majority of the population had a long disease duration and HbA1c more than 8% at the time the combination was started. The lower HbA1c level at the index date, the greater the decrease in HbA1c level was seen. This interim analysis demonstrates that the combination of Gliclazide MR and SGLT2 inhibitor is both effective and safe. Chan Jay spoke at a session on the new real-world evidence on the quality of life of sulphonylureas users in Asia. The JADE study, where she revealed that disease duration, lifestyle, complications, high HbA1c, and hypoglycemia are independent determinants of quality of life apart from demographics. Patients treated with oral glucose-lowering agents versus lifestyle modifications in sulphonylurea versus non-sulphonylurea showed worse glycemic control, more complications, and poorer health-related quality of life than their comparators. In the sulphonylurea group, glycoside-treated patients showed better health-related quality of life, likely due to lower HbA1c and lower risk of hypoglycemia and dyslipidemia. Christophe presented a session on importance of time in range and glycemia risk index in diabetes management, where he highlighted that not only glycemia risk index but TIR2 as single metrics are not a substitute for looking at individual metrics. TIR and the glycemic risk index do not distinguish between hypoglycemia at different times of day. For example, nocturnal hypoglycemia or pre- or postprandial hypoglycemia. Differentiating between daytime and nighttime glycemia patterns will be necessary for specific treatment decisions. Emma revealed second-generation basal insulin analogs may represent an effective treatment option for many individuals ready to progress to insulin therapy in an intriguing session on balancing outcomes for people with T2DM receiving insulin-based therapies. For people with T2DM who are insufficiently controlled on basal insulins plus GLP-1 receptor agonists fixed-ratio combination may represent an effective and simplified alternative regimen versus complex insulin regimens. Simplifying treatment regimens may help to reduce disease burden and improve the daily lives of people with T2DM. This concludes our coverage of the HDTV updates for Day 1 of the IDF 2022. We'll meet again tomorrow. Have a good day. Hello, this is Luis. Welcome to the HDTV updates from the IDF World Diabetes Congress 2022. Today we bring you the Day 2 updates of IDF 2022. Bailey presented a session on the role of SGLT2 inhibitors across the cardiometabolic-renal risk spectrum, emphasizing that SGLT2 inhibitors have the potential to achieve metabolic control, offer cardiovascular and renal protection, and have a place in major guidelines in patients with established ASCVD. SGLT2 inhibitors slow the rate of eGFR decline, improve renal composite, and decrease albuminuria. Several clinical trials have revealed renal protective effects in patients with CKD and albuminuria. In addition, the landmark trials such as DAPA-CKD EMPA kidney revealed positive renal effects in people with and without diabetes. Colagiuri S. spoke at a session on the new face of sulphonylureas in the era of newer OADs, emphasizing that sulphonylureas should not be regarded as the ugly duckling of OADs. Sulphonylureas control glycemic levels, reduce macro and microvascular complications, are safe, easily accessible, inexpensive, and well tolerated by patients. Sulphonylureas are still recommended as a second line of treatment by major guidelines. Newer agents can help with T2DM management, but in areas where resources are scarce, a more pragmatic approach is required. Even if the cost of newer agents fall, the benefits of sulphonylureas will be supported by robust and long-standing evidence. Bailey C. spoke at the 65 Years of Metformin session. Metformin has occupied first place in all major guidelines since its synthesis in 1922. Its favorable effects on glycemic levels and cardioprotective effects keep it as a first-line therapy for T2DM. Rossing stated during a session on the cardioprotective mechanisms of SGLT2 inhibitors that a high dose of dapagliflozin improved renal oxygenation in people with type 1 diabetes and albuminuria within 6 hours with no indication of a change in renal oxygen supply. By reducing inflammation and fibrosis, such improved oxygenation may contribute to the long-term renal beneficial effects of SGLT2 inhibitors. However, it remains to be seen whether the observed effects are sustained with chronic treatment at lower doses and whether they also occur in type 2 diabetes. Tesfaye presented the findings of the latest clinical trial evidence on painful diabetic neuropathy, option DM, which found that amitriptyline, duoxetine, and pregabalin are all equally effective. This is the first study to examine treatment pathways, the longest comparative effectiveness study in diabetic peripheral neuropathic pain patients, and the only one to include more than 2 medications. Combination therapy results in a further numerical rating scale drop of 1 and greater pain relief when compared to monotherapy. In addition, he stated that combination therapy is well tolerated. This concludes our coverage of the HDTV updates for Day 2 of the IDF 2022. We'll meet again tomorrow. Have a good day. Hello, this is Luis. Welcome to the HDTV updates from the IDF World Diabetes Congress 2022. Today we bring you the Day 3 updates of IDF 2022. Bailey presented a session titled Efficacy and Safety of Tirzepatide in Type 2 Diabetes, the SURPASS clinical trial program, in which he reported that Tirzepatide demonstrated robust efficacy on HbA1c and body weight reductions in patients with varying background therapies, varying mean diabetes duration, and CV risk. It was also demonstrated that 81 to 97% of patients had HbA1c levels less than 7% and weight losses greater than 15% from baseline. Tirzepatide was well tolerated, with no adverse effects and improved metabolic parameters. In a session titled Updates on the Assessment and Treatment of Diabetic Sensory Neuropathy, Perkins stressed the importance of developing an efficient, practical approach to diabetic neuropathy assessment and management. There is also a need to consider alternative neuropathy causes. Finally, the new evidence on the management of painful diabetic neuropathy, including drug and device combinations, as well as cognitive behavioral therapy, must be explained. Bailey emphasized in a session on dual SGLT1 and SGLT2 inhibitors that both dual SGLT1 and SGLT2 inhibitors delay absorption and increase glucoseuria. Furthermore, he stated that sotagliflozin, a dual SGLT1 and SGLT2 inhibitor, has demonstrated favorable metabolic effects such as increased intestinal absorption and increased GLP-1. He also reported that when combined with optimized insulin therapy, sotagliflozin significantly increased glucose TIR without increasing time spent below 70 milligrams per deciliter, and decrease PPG, thereby improving glycemic control in type 1 diabetes as well. When discussing the future of oral insulin, Shashank Joshi stated that oral insulin can overcome the practical challenges associated with injectable insulin therapy. Multiple oral formulations have been tested in clinical trials with limited favorable results. Currently, ORMD 0801 and Trigopil are undergoing further development. The effectiveness, safety, and cost-effectiveness of these promising oral insulin formulations in real-world practice remain to be seen. Home, in an interesting session on biosimilar biobetters in diabetes, the evolving global landscape, underlined that a variety of different types of insulin-based medicines are available globally. Advances in formulation and structural changes, amino acids, and adducts have provided us with useful new properties and will continue to do so. He further stressed that biosimilar regulation has ensured quality, but limited cost savings. Patient psychological dependence on their familiar insulin limits interchangeability, but with support can allow substitution. Lazarus, in another session on new models of care to address fatty liver disease in diabetes, envisioned the key actions which are important to prioritize NAFLD public health. An organized agenda outlining what research and action is required. He said that we need to move the issue outside of the liver health space and make it part of others' agendas, example, NCDs like obesity and diabetes. He concluded by emphasizing the importance of establishing multi-stakeholder collaborations across sectors and disciplines, as well as engaging with WHO on a global and regional scale. This concludes our coverage of the HDTV updates for Day 3 of the IDF 2022. We'll meet again next year at IDF 2023. Till then, stay safe.